All across Saskatchewan, there is a transformation taking place in healthcare. We're rethinking how healthcare is delivered, focusing on the needs and wishes of the patient, while at the same time improving the efficiency of care delivery. In the city of Yorkton, this transformation is seen in the development of one of the province's new primary care innovation sites called Patient Central. In July of 2012, a group of physicians, medical staff, patients, family members, and healthcare administrators gathered to design the layout of this new clinic. Over a one-week period, this collaborative group went from idea to building full-size mock-ups. The Patient Central project is led by Dr. Philip Fourie and a team of physicians.
The facility that we are building is going to be an innovation center for delivery of primary care for this health region. It is something that patients have said that they want. It is something that the providers in the region have said that they want. It is something that our health region administration and senior management has said we need to change the way that we are doing things.
A new clinic, you know, maybe they'll have more to offer for people like me with diabetes. And my mom, she was 67 when she died. She died of diabetes, and she never really got the attention that people needed. She didn't have any knowledge of diabetes, just lived with it. And I saw her slowly die. With a clinic like this, it's going to be very convenient for people, for First Nations, for elders, you know, for children.
Primary care is care delivered to meet the specific needs of the community. In Yorkton and region, this means treating a significant elderly population and a population with higher than average incidence of chronic diseases like diabetes, obesity, and heart conditions.
We often have recommendations that we need to make to physicians, or else we'd like to refer the client to other services or programs within the region. That leads to multiple appointments for our clients. There can also be that delay in time waiting for that next appointment. Also, here in the city of Yorkton, a client has to go throughout the city to these different services. So with this new primary care facility, this will allow the client to have access to a variety of healthcare professionals under one roof.
Currently, the process that people have to go through when they seek healthcare is quite long, and there's a lot of waste. And I've appreciated evaluating that data and seeing, you know, 3 hours for an ER visit isn't really realistic in this day and age, and the clients are unhappy about that.
Both patients and providers agree that there are many wasteful, unnecessary steps in the healthcare system. The Patient Central facility will remove as much of this waste as possible, thereby improving the patient experience.
Lean is a way that tries to take waste out of the system, take unnecessary steps out of the system to get only the steps that will give value to the patient experience.
Building a healthcare facility is no easy task. It is expensive and complex. The design of Patient Central uses a process called 3P, which stands for production, preparation, process. It is a highly efficient way to bring together everyone who will be involved in the facility to have input into the design, from funders to patients to the administrators and staff of the facility.
I think it's so important to have everybody represented, because this is a community project. It's not a Sunrise project. It's not a Dr. Fourie's clinic project. It's bringing everybody together to really serve our population. That's why it's so important. We had patients and families here as part of this whole mock-up, and it's just fabulous to get that kind of input. It's really invaluable.
It's a lot of work. It's a lot of learning, and everybody in this project, it's all new to us. So it's exciting, and when they get the clinic up and in order and running, and the people get to see how the system is going to work, I'm sure that they'll be much happier than what we're dealing with now.
We started off by assessing what we wanted to do, to get a vision, our mission, and the principles under which we want to work so that we can all work towards the same goal. We then decided what are the services that we want to provide for patients, and we then decided what is the information that we wanted to collect on the current state, what information do we need to plan for a future state. We then spent about 3 weeks collecting data.
This data that was collected tells us about things like the number of patients accessing different types of service and the time it takes to deliver these services. Participants spent many hours thinking and talking about how this data can inform the design process. The group applied what was learned from the data as they went through a series of ever more refined 2- and 3-dimensional designs of the new clinic.
The part that we're looking at right now is moving from where we did individual designs and drawings this morning to now we've broken into teams where we're going to work with the actual floor plan of the proposed building. So we're supposed to take all of those ideas that we brought and the sort of the creative piece where we didn't have the boundaries of a building, and now to bring that creativity into more of a structured piece. So I think what we're looking at is just trying to put the puzzle together and how we get all of the services in that we like and what makes sense for the patient.
And I think the first few days we spent collecting data as well to see which paths a patient would follow through a clinic most often, so that you kind of get an idea where you could streamline things and make it more accessible and more efficient.
We wanted the patient to do as less walking as they have to, especially if they're elderly and maybe in a wheelchair. So we have to think of them as what can we do best for the patient that will make them travel the least amount of distance and get them in and out of there as soon as we can.
We want things to flow naturally. We don't want people to be in a maze, to have to go around a lot of corners and walk long distances and get confused, lost in hallways. So that is what our goal is for designing and building this clinic, is that it will be very easy, first of all, for the patient. And then, of course, we want to make it also very effective for healthcare providers to work in, so that it's a very collaborative environment, but that they don't have to walk long distances as well.
People start feeling like, you know, this is a bit more real of a process. I can see what this might look like now, and what we're trying to do is design it so I can move through the system in a really simple and easy way and get everything that I need, or the system can move to me. That's a very exciting part for a lot of people because it started to become really real for people today.
The 2- and 3-dimensional design process was highly collaborative as the teams would share their design ideas together. Eventually, the best overall design was selected to be scaled to actual size.
I'm building an exam table that we can put inside our pretend room, exam room over there, so we can get a good feel of how the room is going to flow and going to work. Because there's nothing that I hate worse than having an exam room with no room to maneuver. So I think this is a very important step.
The week-long 3P design process culminated in a report out to the public. This report out included a demonstration illustrating what it would be like to use the future clinic. One of the scenarios was patient Mary, who comes to the clinic to have a form signed. By using a team-based care model, the providers soon discover Mary is over-medicated. The team then collaborates in modifying Mary's care plan.
Too much medication. Okay, we'll get the lab to come and draw some blood work on Mary while she's here today. So we'll bring Mary in and give her a full checkup today.
What happens next? The 3P plans will be preserved and passed on to the architect and design team. Over the coming months, there will be work done to refine how services will be delivered to enhance the patient experience. Some of this will be done through 1 or more rapid process improvement workshops. So, was the week a success?
I think it's just amazing teamwork and speaks to how when you work across a cross-functional team, what great results you can get together. This has been long in the making through the new innovation site, and pulling everybody together and bringing this to fruition at this point is just awesome to see. I'm so proud of everyone.
The greatest thing is, the important thing is that the clients, it is a one-stop shop. You know, they'll have that access, which is really nice, especially for our elderly population. That transportation is an issue.
You know what? If this small city in Saskatchewan can do something this amazing, the rest of the province can, and perhaps maybe the rest of the nation.
At some point in time, once this clinic gets built and in operation, I will be very proudly able to go to that clinic and drive by that clinic and say, you know, I had an input into this, and I'm very proud of it.